Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. This show is all about exploring health topics that matter to you and your family. We appreciate the opportunity to introduce you to local physicians and healthcare professionals who serve as our health experts. Our first guests today are Tara Mansour and Kara Peterson of Novant Health Brunswick Medical Center Radiology Department. And our last guest today is Dr. Anthony Dominic of Cape Fear Cancer Specialists, who are part of Novant Health Medical Group. Stay tuned to HealthWatch to learn more. Our first guests today are Tara Mansour and Kara Peterson of Novant Health Brunswick Medical Center Radiology Department. Welcome, Tara and Kara. Thank you so much for being here today, and I hope I can keep your name straight. It's like a rhyme. Well, you both work at the Novant Health Brunswick Medical Center Radiology Department. So tell me about your role. We'll start with you, Tara. Tell me about your role at Brunswick Medical Center.
Okay, I'm the multimodality supervisor of the radiology department. So I basically supervise the workflow from day to day and take care of patient care and make sure that the techs have everything that they need. And as far as the mammo department, making sure their schedule is set up properly and they have all the items that they need for day-to-day activity.
You said multimodality supervisor. What does that mean? What is modality?
Modality is as mammo. So you have your mammography department. That is a modality. You have your x-ray department, your CT department. So I have 7 different departments under me.
That's a big job, Tara.
It is. It is. I have a big responsibility, but I enjoy what I do. I do.
Yeah.
I enjoy what I do.
Well, Kara, it's nice to have you on the show today, and I love your pink pants.
Thank you.
Tell me what your role is at the hospital.
So I work in direct patient care and mammography, just taking patients back, doing the screenings, diagnostic, things like that. I work on the mobile unit as well, so I'll be in the department one week and out on the mobile unit the second week. So just mammography.
Well, thank you for sharing that. So October is Breast Cancer Awareness Month, and this is the month of October. So that's a really important topic. I don't think, I think the more you talk about it, the better we're all going to be. So we appreciate you guys sharing this information with us, especially around screening. So generally, at what age does a woman start to get her first screening mammogram? And then what about the men out there that need them? Talk to me a little bit about that too.
So women, normally, if you don't have any family history, then you start at the age of 40. If you do have family history, we normally go about 35 years old. As far as men are concerned, we don't do screening mammograms on men, we do diagnostics. So men, if you have a lump or an issue with your breast tissue, then you would come in and we would actually do a diagnostic mammogram with a possible ultrasound to follow.
Wow, that's interesting. So how often, once you start having mammograms at say 40, how often should you have them in the future?
That's an annual recommendation.
So every year?
Yes, ma'am. So as long as it's just a screening, there's no problems, you'll come every year. If there was something found on your mammogram, you would come back, you know, depending on what the radiologist suggested, either a short-term follow-up, long-term follow-up, or you come back the following year for another diagnostic mammogram. But the recommendation for just general screenings is annually.
And I think most insurances pay for once a year. Some things are a year and a day, or
Usually, most insurances now, they follow what Medicare does, and it's within the month.
Yep.
Oh,
So it's not even the year and
That's
day
good to
anymore,
know.
so it's within the month.
yeah, because we used to have to be so careful about that date
We
and
did.
add a day to
We
it.
did.
Oh, well, that's
have to
great. So, Kara, let's talk about the actual process. So you're actually in the room conducting the mammogram. Is that correct?
Yes, ma'am.
So there may be some women out there who haven't had mammograms yet and they have no idea what to expect. So walk us through what that looks like.
Okay. So when the patient comes in, they register like they would for any other appointment. From that point, we'll bring them back from the registration area. They come back into the exam room. We have a series of history questions that we go over with them, personal history, family history, surgical history, things like that, OBGYN history questions that would relate to what we're doing. We go over those, and as long as the patient is asymptomatic as far as screenings go, we just go ahead to the routine exam. We'll do about 4 pictures usually, 2 of each breast. We apply compression to the breast during that, during the exam. I would not say it's painful. I don't like to use that term, but everybody gets these horror stories that a mammogram is so terrible, and it's not like that anymore. We do those images, and then once we're done, it takes maybe 5-10 minutes at the most. The patient will be good to go, and they follow up with results in a couple of days, depending on what the radiologist determines.
So does the radiologist read it right away? Is there an initial read that's done right away so that if they see something, they might do something extra?
So as far as a screening mammogram, the radiologist normally reads it within a 24-hour period.
Okay.
If it's a diagnostic, it's read right then while the patient is still in the building, and the radiologist may even go and speak with the patient at that time as well.
In terms of getting prepared for the mammogram, you have dressing rooms where the patients are escorted to, is that correct?
Yep.
And then what happens then?
So typically we go through the routine to bring them back. They'll go straight into the dressing room. We'll get them changed. They put on a gown, so just from the waist up they'll change into a short gown that opens in the front. No deodorants, lotions, or powders, so if they came in with that, they'll have to remove that. But most of the time the scheduling department, when they're putting them on, will tell them what to expect as far as that goes. So they'll change into the gown, and then we usually go over those history questions once they're ready, and then go into the exam.
This might be a dumb question, but it probably would be easier if women wore pants and a top,
Yes,
right?
exactly.
Because the gowns are short.
Right. We do have long gowns for patients that
So if,
do come in.
if I wore a dress, which often I do it, and I have mine at work, then there's something else I can wear rather than just a little short one.
Right.
How about jewelry?
That doesn't
Do you have to
necessarily
remove everything?
No, not necessarily, but necklaces, if they're bigger,
Long.
bulky necklaces, those will have to be removed. But a long necklace, we can really just turn that around to the back. Earrings, if they're really long, we take those off. But just like little stud earrings and things like that, watches, jewelry, bracelet, on anything like that does not matter.
Okay. All right, that sounds good. And we talked a little bit about results, and you say if they identify something during that 24-hour period when they're reading the mammograms, then the patient, how would the patient find that out?
So the results, as soon as our radiologist signs it, if the patient has a MyChart account, it directly goes into MyChart.
Yeah.
And so then they get an email stating they have results, and they can open that up right then, and they know. Or their primary care physician, they actually get those results at the same time. So the primary care could also call the patient whenever they have a chance to review as well.
So
We also send a letter in the mail letting the patient know the results of their exam.
but that's after, that would be later on.
That would be later, yep.
Later on. Will the patient, I know there's a new law that says that the information is released right away to your MyChart account. And so would the patient be able to see a bad result?
Yes, any result.
So that you need to be prepared for that.
You do. And the techs, whenever they, especially with the screening mammograms, they let the patient know whenever they're walking them out that they're going to get their results of their exam.
Oh, that's
and it
good.
could be, hopefully everything will be fine, but you get your results whichever way it may go.
And we always make sure to let them know that their doctor will follow up, especially if there is a significant finding. The doctor will follow up with them, and then they'll get a call from our scheduling team to get scheduled for that follow-up study.
So let's talk about where you can get one. Are there other resources? Does Novant Health have other areas or resources where you can obtain a mammogram?
We have the main location here at the hospital, but we also have the mobile mammography bus, which I touched on earlier. Most of the time, right now, Mondays and Tuesdays, we go out to the South Brunswick Imaging Center out Calabash area. We go there, like I said, most Mondays and Tuesdays, but there are some other locations we're trying to get into. Our scheduling team has access to wherever we go for that. Currently, that is only a 2D unit, so if the patient wants to have the 3D screening, they'd have to come here. But for patients that live on that side of town and would prefer to just come to the mobile, we do get a lot of those. It's very convenient for them. But like I said, we have that big schedule that the scheduling department works off of.
Tara, do you handle that schedule?
So we have a centralized scheduling team as far as if the patient wants to call to get placed on the mobile mammography schedule. But as far as getting folks signed up, like getting places for us to go to station our mobile mammography, absolutely. They can call me directly and we can get them, get the mobile mammography bus out to whatever facilities or places that may want us outside of their building.
So if there's like a business or a church group
Correct.
or somebody like that who would like to host the mobile mammography unit, they could contact you and set that up.
Absolutely.
I'm thinking of women's groups at church and stuff where you could do 20 people.
Yeah,
and,
Absolutely. And we're actually we're marketing now. We go out at least once a month, maybe sometimes twice a month. And we've been going to even communities to maybe go to some golf courses and things like that, just to even put the mobile out there.
That's awesome. How can women, where can they call to make an appointment? Now, they already have a primary care, so they need an appointment. How's that done?
They can call our central scheduling line, which we can give that information out. If you just want to know where we are, you can also go onto the novanthealth.org/gopink website, and it tells actually where the mobile mammography van will be that day. But just to schedule, just call the central scheduling line.
And I think that's 910-721-1485.
Yes, ma'am.
All right. I didn't realize the entire schedule was on there. So if you're looking for the mobile mammography unit, you can go to the novanthealth.org/gopink and the schedule will be there. And it tells you on a daily basis where it is.
Correct.
Wow.
Correct.
That's awesome. You touched on one thing, 2D versus 3D. Tara, can you talk to me a little bit about that?
Sure. So as far as 2D is what a lot of folks, what we've always done. Now the gold standard is 3D. So it's still the 4 projections of the breast, 2 on each side, but it's a little bit longer of a projection. So you get to see more slices of a breast, I guess you would say. So you see more of a breast tissue. So as I said before, the 3D is definitely the gold standard. And
that's what we have here at the hospital.
That's what we have here at the hospital, and that's what we will have on our mobile. Hopefully in the near future, we are getting a brand new mobile, so we're very, very excited about that. So then we'll only offer 3D for our community.
Throughout our facility, it will be
Absolutely.
3D for everybody.
Yep.
That's awesome.
Yep.
I can't tell you how important I think this information is. Thank you so much for being here today. What would you say to ladies out there putting it off?
Don't.
Yeah, don't put it
Don't
off.
put it off. Your breast health is very, very important, and we are finding it a lot sooner these days, especially with the 3D. So we're able to start the process of taking care of those issues a lot quicker than what we have normally done. So please do not put your breast health off.
Yes.
It can make a huge difference. It
very
can
much
save
so.
your life.
Absolutely.
Absolutely.
Well, thank you so much for being here, both of you. It was great to see you, and I hope you'll come back. And congratulations on the
Thank
baby
you.
bump.
Thank you.
Thank you.
You're welcome. Our next guest is Dr. Anthony Dominic of Cape Fear Cancer Center and the Novant Health Medical Group. Dr. Dominic, thank you so much for coming on my show today.
You were very welcome. Thanks for having me.
I am really excited to learn about you. So let's start with your education and your background. Where did you go to school?
Yeah, so I'm originally from Kansas, actually, but ended up going to college at Loyola University in Chicago.
Nice.
And then I went to medical school at Lake Erie College of Osteopathic Medicine in Florida.
Oh, in Florida.
And then I completed my residency and fellowship training back in Kansas at Kansas University. And then I started my first job here.
Oh, so this is your first stop.
It is, after fellowship.
I'm curious. I always like to ask this of people who didn't grow up here. What brought you to the coast?
Yeah, so it's a funny story. So I obviously did my medical school in Florida and fell in love with the ocean. I've always wanted to come back to the ocean.
Yeah.
And so when I was looking for places to apply for jobs, I'm like, okay, well, it's warm down here and these are nice areas. So I started applying to jobs. And then one of our partners, Dr. Lindsay Prochaska, and I actually trained together.
Oh,
and
nice.
so she works at the group over in Wilmington with me. And I didn't know it when I applied. And she was like, get here on a plane immediately. She's like, you have to come out here. And so I flew out here and kind of fell in love and came back and still loved it. And now I'm here.
Yeah, it's a great place to live. We've been here 23 years, my husband and I, and
it's beautiful.
We call that home. So I understand you're an oncologist with Cape Fear Cancer Specialist, and that you see patients in Leland
We do.
3 days a week. So tell me a little bit about Cape Fear Cancer Specialists.
Yeah, so we treat pretty much all kinds of cancer with some few exceptions that we would have to send outward. There's currently 10 physicians practicing. We have an 11th physician starting in a couple weeks. We have two main locations. Our first one's in Wilmington next to the hospital, and then we have a satellite campus that's out in Brunswick to serve sort of patients in the more inland regions of the coast. And we pretty much provide most of the same services at both of those places. And a lot of the doctors rotate between the two locations.
As ours do too. So that's an easy drive for folks from this end of the county to Brunswick Forest.
Yeah, absolutely.
Yeah. So the Brunswick Forest location, they have on-site laboratory and pharmacy, correct?
Yes.
And I think you do some infusions there. Is that correct?
Yeah, so we pretty much have the capabilities of doing everything that we can at the hospital with the exception of blood transfusions because we don't have a blood bank at that location. And so patients come out there, they get their labs are back before they see me, and then they get their treatment. So usually the lab turnaround time is between about 5 and 11 minutes.
Oh, wow.
And so by the time they're waiting for me, getting roomed, vital signs, that sort of stuff, it's usually back and we're ready for treatment by the time I see them.
Oh, that's
so it's really nice.
That's nice. Well, I understand that you have a clinical interest in hematology.
I
correct?
do.
And I don't know that everybody knows what hematology is. So can you sort of give us the generic version of hematology?
Sure. So and our training is combined. So we do oncology, which generally refers to cancer, and then we do hematology, which is everything related to the blood.
Okay.
And so there are lots of blood disorders that are cancerous and non-cancerous. And so as a kind of being interested in hematology, I'm kind of interested in those problems that folks can have.
And I understand that you see benign and malignant hematology patients. So talk to me about the difference. Why would you treat somebody that's not malignant?
Yeah, absolutely. So there actually is a huge need out there, and there are a lot of patients that have abnormal blood counts, and all of your blood counts come from your bone marrow, which is kind of our organ that we claim in hematology. And so if patients have elevated blood counts or low blood counts, oftentimes their primary care doctors don't exactly know why that is. There's bleeding, clotting disorders, things like that people accumulate over time, particularly a lot of blood clotting issues with other medical problems. And there's a lot of questions as how does this need to be managed? Do we need further workup? And when patients kind of have complicated medical issues, we're sort of in tune to sort of teasing out how that needs to be managed. That oftentimes gets kind of sprinkled in with the rest of cancer care, just because there isn't usually a huge interest for that. The malignant hematology is what we call liquid tumors, where it is cancerous.
Liquid tumors?
We call them liquid tumors instead of solid tumors, meaning they come from the bone marrow. So things like lymphoma, acute and chronic leukemias, multiple myeloma are more referred to as liquid tumors, whereas like a breast or a colon cancer would be a solid tumor.
Yeah, I see that. I'm curious, is there more hematology the need for hematology greater here in this area for any reason?
So I think that there are fewer people probably interested in hematology in general, but I think it's probably kind of a need across the board. As our patient population is aging, there's a lot of people moving down from the north. It's an older population.
Right.
And so those are the people that are having problems with low blood counts, anemias, blood clots, that sort of thing. So I think it kind of comes with everything.
Do you have any idea about misconceptions on cancer treatment? Do you hear things about that?
I do, and so we were just kind of joking about this, but I'm one of the younger ones in our practice, and so the time that I have trained in hematology and oncology, we're able to get a lot of people through treatment. And so probably the biggest misconception that I have is somebody will come into my office, we talk a little bit about their diagnosis and what we need to do to treatment, and their initial response is, I'm not getting treatment, my neighbor got treatment and died from the treatment. But our supportive care and the treatment that we use has really been revolutionized the last 5 to 10 years. So the types of treatment that we use, the way that we manage side effects of treatment has changed and improved significantly to really make a lot of cancer care manageable so that patients can really live their life while they're undergoing treatment. That's not always the case, but it has improved substantially. So that's probably the biggest, misconception is they know somebody who tolerated treatment very poorly. And one, the treatments probably have changed, and two, we're better at managing those side effects. So that's probably the biggest thing.
I know this question isn't written here, but I'm going to ask it anyway. Talk to me a little bit about the method of administration for chemotherapy. There's lots of different ways to get it, correct?
Yeah, absolutely. And that also has changed quite a bit because, so traditionally chemotherapy was given in the IV. So the patient comes in, gets an IV
That's
hooked
what
up,
I always think
or they have a port and they're kind of hooked up to the pole, which is what you see in the movies. That is no longer the only way. So we have chemotherapy that we inject with injections, just kind of going underneath the skin. We also have it in pill form. And those are probably the 3 most common ways that we administer it.
Well, I was just curious about that. Let's talk about recommendations for screening tests. I know this is October and it's Breast Cancer Awareness Month, so it's in the forethought of all of our heads. So how important is it for people to get their mammograms and keep up with those things?
So, in several studies, mammograms have shown in breast cancer as a whole, and what I tell patients when they come to see me, so early stage breast cancer, a majority of those women are going to be cured from their disease. Not everybody, but if we catch breast cancer early. Stage 1, stage 2, stage 3, a majority of those women will be cured of their disease. The way to catch it early is to do those routine screening mammograms, which generally you should talk to your doctor about starting at 40. Definitely after 50, but even starting at 40, most insurances and things cover it because it's a preventative measure, just like anything else. And if you're going to catch it early, your chances of surviving that breast cancer are going to go up significantly, as opposed to if it's caught late.
I know this pandemic has really put a hurting on us getting out and getting routine physicals and exams and what have you. And more importantly, they just need to go ahead and do it. In order to catch it early, you have to have those mammograms.
Absolutely.
And I think we would be remiss if we didn't talk about the importance of having a primary care physician. Because they can keep track of those those tests
Yeah,
and
absolutely.
the screenings that you need to have done. And especially if you're part of our group, you have my chart. So you have all those little things that pop
Reminders.
up and say you're late for your mammogram, you're late for your colonoscopy. And so
Yeah.
that really helps too.
Absolutely.
Are there any other cancer screenings that you feel that patients should pay attention to?
Yeah, so, and there actually was there were a couple of recent changes, and one big one I want to talk about that I think it's a good question. So colonoscopies have long been known to do the same thing. So, what a colonoscopy is the doctor goes inside, and if they see a polyp, that polyp has the potential to develop into a cancer, and so they remove that polyp.
Right.
Unfortunately, we're seeing younger and younger people get and die from colon cancer. And so recently the CDC changed their guidelines. Initially it was start your screening at 50. Now it's 45 because we're seeing a lot of young people with colon cancer. Most people know about colonoscopies because they have heard somebody have had it.
Right.
But that age has changed, and I think most people are catching on with that. Probably the biggest cancer screening that I see missed here since I have started, that I probably order a couple a day, are people who have smoked for what we call 20-pack years, meaning that if you take the amount of cigarettes that you smoke, so 1 pack would be 1, and multiply it by the years that you smoke. If you've smoked more than 20 pack years, you should have a CAT scan of your lungs every year from age 50 to 80. And it is very common that I have somebody come to my clinic for a hematologic problem, and I smell the smoke, or I ask them about smoking, and I ask them, have you had your lung cancer screening? And oftentimes they either have not had it, or they tell me they have a chest x-ray. Again, kind of going back to what we talked about breast cancer, so catching lung cancer early is how we cure people from it, not catching it late. And so they had done some studies several years ago, and it showed that, hey, if we screen these high-risk patients, we're able to not only catch these lung cancers sooner, we're able to cure more people from lung cancer. So that's one that I personally have been kind of promoting quite a bit, because it's definitely less heard of or less recognized than the other two.
Yeah.
And that came out a couple years ago. And just because I deal with cancer a lot, for me it's like one of the top things I talk about, but it may not be known by everybody.
Wow. What great information.
Yeah.
I'm sorry I haven't had you on sooner. And I think there's so much more to talk about. So I'd love for you to come back.
I absolutely would love to.
Well, thank you so much for being here today. It was a pleasure to have you.
Thanks for having me.
You're welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. Regular viewers will notice that we're once again masking, and that's due to our following the latest CDC guidelines for COVID-19. This last year and a half of the pandemic has been rather hectic, and as a healthcare worker and as a member of this community for many years, I just want to remind all of you and my neighbors that I want you to be safe. At Novant Health, we are encouraging everyone eligible to protect themselves to get the COVID-19 vaccine. If you aren't vaccinated yet, and you may have specific reasons why, you may have questions, so take the time to learn more about the vaccine. Talk to a trusted physician or provider. Ask questions of your pharmacist. Look for accurate information from reliable sources. If you want to find a doctor and make an appointment to talk through this topic, please visit novanthealth.org. If you'd like more information or you're ready to get your vaccine, the state has set up a website that will give you lots of information. So you can visit that website at covid19.ncdhhs.gov. We will get through this together. So until next time, have a great day and stay safe.
This is ATMC TV, your community channel. ATMC TV is your community channel, bringing you the best of where you live. Stories about local people and businesses. Staying fit and living well. Coverage of high school sports. And the area's only local cooking show. Tune in to ATMC TV, your community channel, only on ATMC Cable, Channel 3 and HD Channel 910. Watch online at atmctv.com.